Welcome everyone, I'm Péter Vámosi, and it is my honor to be able to present to you the work and the progress we have achieved in the last 3 months in the topic of reducing the complication rate of cardiac electrophysiology procedures. Let me introduce myself. I'm a third-year cardiology fellow and a PhD student starting this September, what means a full-time PhD student as participating in the Translational medicine program, and I'm working at the Heart and Vascular Centre of our university. My vision is being able to work at Semmelweis University while it will have achieved being one of the top 100 universities of the world and one of the top 5 leading medical universities in Europe. And my mission right now is to participate in achieving this goal with my current means and tools in whatever role I might contribute to this. The specific projects what we are working on as members of the Translational Medicine Center is the ultrasound guide is a comparison of ultrasound guidance versus the conventional guiding technique during venous puncture in invasive cardiac electrophysiologic procedures. First of all, we started to do a systematic review and a meta-analysis. And based on the experience we have gathered during this work, we also decided to do a protocol and to initiate the conduction of a randomized clinical trial in this field. First, let me speak about the first project I mentioned you earlier. Some of you might know, some of you might have forgotten the details of cardiac electrophysiology procedures. So this is an invasive way of diagnosing and treating cardiac arrhythmias. It's an invasive way. We need to get to the inside of the heart with our catheters, so of course we need venous access. This is most commonly happening by the puncture of the femoral vein. And we know from our practice and also from the review of the literature that a lot of complications after these procedures are related to the vascular access and not to the actual electrophysiologic procedures inside of the heart. These complications might have a negative impact on the quality of life of the patient in the worst case, or they might prolong the hospitalization of the patient and may make the costs of its treatment bigger. Of course, ultrasound is able to clarify the anatomy of the vessels in the region of the puncture and to give us a guidance during doing this puncture. This technique is already widely used in other fields of medicine like anesthesiology, intensive care, nephrology. It is also included in the guidelines in these fields. And it's also a practice in some of the centers doing cardiac electrophysiologic procedures, but it's not yet standard practice and it's not yet included in the guidelines of our subspecialty. The clinical question we are investigating is whether ultrasound guidance during venous puncture during electrophysiologic procedures reduces the complication rate, especially the rate of major vascular complications, in comparison to the traditional landmark and palpation-based techniques. That's why we want to include as population adult patients undergoing cardiac electrophysiology procedures. Of course, our intervention will be the ultrasound guidance as a routine technique during femoral venous puncture, and the comparison will be the traditional technique, anatomical and palpation-based puncture. The outcomes we want to assess are the major vascular complications, which are defined in the consensus document of the arrhythmia societies of 5 continents. So it's an established definition what we want to follow during our work. The hypothesis that ultrasound guidance will reduce the rate of complications, and of course, if we are able to prove this, this might end up in the guidelines of our field. This has to be able to influence everyday clinical practice and contribute to decreasing the number of complications of our procedures. We did a systematic search with the search key you can see on the screen. We have found approximately 13,000 articles. We are still in the process of removing those papers which don't belong to our selection protocol. So we are right now at 5,244 in the process of doing the title and abstract selection. Regarding my second topic, which is also covering the same field but from another aspect, during the preparation of the meta-analysis, we have seen that there is only one randomized clinical trial covering this issue, the so-called ultra-fast trial, but they had to terminate inclusion to the study earlier than expected because they had lower rates of complications in both arms, also in the control arms. So they saw it won't be feasible to conduct the study, and with the results they have achieved, of course, they were not able to show any benefit, any significant benefit of ultrasound guidance. We want to cover the same question in this field, and of course, if we are able to have results also during a clinical trial, a randomized clinical trial, this will be able to enhance the level of evidence with which our findings might be included in the guidelines later on. We want to compare, of course, the conventional technique with the ultrasound guidance during the puncture. We want to assess the major vascular complications, that means hematomas, AV fistulas, and pseudoaneurysms, which are requiring transfusion, surgical repair, or they are prolonging hospital stay. We also have a lot of secondary outcomes, the subtypes of these, and minor complications, and some procedural parameters. The RCT I showed you had found positive results respecting the procedural parameters, but we want also to achieve significant results in the primary outcome. Thank you for your attention. I have here included a quote from Winston Churchill, which is an actual quote from Winston Churchill, not like the one most widely known about statistics, which is actually a fake one. This was said by him, and I'm looking forward to getting your questions. Thank you.
I have a question regarding several. Probably I did not catch it. Why are you only looking at femoral puncture? I think we don't have to use ultrasound when we are doing the electrophysiology using the radial artery.
No, electrophysiology, in most of the cases, it needs venous access.
Sorry, I missed that.
Yeah, because we do have bigger catheters than our colleagues in the coronary intervention labs. So that's why even if we use arterial access, we have to do it using the femoral artery as well. So the inguinal region is like a prerequisite to be able to use these big sizes of catheters, what we have to use right now.
I understand, thank you. As you were saying at the beginning, some of us probably forgot some of the detail.
Probably you also said that what is the level of complications normally? I mean, with the standard procedure.
You mean the actual rate of them?
Yeah, yeah.
It differs what kind of paper you are looking at. They are being reported from 0.8 to 4.5%. Of course, it depends on the definition of major complications. It depends on the definition of complications themselves. So that's why there might be this kind of discrepancy in the data being reported.